Good morning, everyone. This is Andy Reese with Department on Disability Services. Welcome. I see that I don't see. I see that we have 134 people with us today. I'll just start with giving an update. If people, as people know, the data for DDA is available on the mayor's coronavirus.dc.gov website. What you may have noticed is that for the past week, that data, for the most part, has not changed. The only thing that has changed is the number of people who have been classified as recovered has gone up. We continue to have 193 people who have tested positive, which has been the same since last week. Of those 193, unfortunately, we have lost 25 to COVID-19. Currently in the hospital is 6 people. This is the data as of the end of the day yesterday. People who received inpatient care and have been discharged from the hospital is 59 people. And people who have been diagnosed and have not required inpatient care for COVID-19 is 103 people. And I know that people have asked about and want me to provide the kinds of placements that those folks are in. So host home is 2 people. ICF is 70. People who live in their own homes, 13. We had 2 people who lived in nursing homes, 26 people who were in residential habilitation placements, and 79 people in supported living placements. We have also had 230 provider staff who have tested positive. Of those, there are still currently 92 who are out because of that positive result. 111 of them have returned to work. 31 are not returning, and 6 of the provider staff have died related to COVID-19. I wanted to provide a brief update for people. As you know, we are currently in stage 1 of reopening, and the mayor provided some information last week and some update this week regarding what the metrics are for moving to stage 2. For our purposes, what stage 1 has meant is that there's no longer a stay-at-home order. However, you can leave your home, but there's not a lot of places you can go. Because during stage 1, for example, libraries are not open yet. However, there are select libraries that provide curbside service. Restaurants are open to provide service if they have outdoor dining with appropriate social distancing. Places of worship can provide in-person services, but only for up to 10 people total. Parks are open, but not for any kind of group sports, and playgrounds remain closed. And so it is true that things are, retail stores, you can make arrangements to purchase something online and go pick it up curbside from the store. You can now go get your hair cut by appointment only, and there's limitations on how many people can be in there at a time, the kind of space requirements there are. So we will, the next phase 2, things will open up a little bit more. And as I said, the mayor shared this week or late last week what the metrics are that they are looking for in order to move to phase 2. And I think you can see that if you're participating via WebEx. I've shared my screen so that you can see what those metrics are. There's a number of different things that we're looking at. First is that we continue to see this sustained decrease in community spread. We have to see a sustained decrease for 14 days. And, as you know, on the mayor's website, they share every day the number of new positive cases, and so we need to keep seeing those numbers go down. And we need to see a transmission rate that remains below 1 for 5 days. Currently, the transmission rate in DC is at 0.9. So we are meeting that metric at this point in time. We have, at this time, 9 days of sustained decrease, so 5 more days to go in terms of that metric. We have to see a low rate of positive test results for people who test for coronavirus, and that result has to be less than 15% for 7 days. The current positive rate in DC is 7.5%. We have to continue to see adequate healthcare system capacity, which means that we have to be using less than 80% of our hospital and healthcare capacity so that we could manage any surge in the need for healthcare. We have been at 75%. We've been under the 80%. We're currently at 75. We've been under 80% for 10 days. We have to be under 80% for 14 days. The last two metrics relate to contact tracing. And this is where the district has really engaged in quite an effort to increase its capacity for contact tracing, hiring literally hundreds of people between the district government and some contract agencies, and in addition to that, detailing a number of staff throughout the district government to work for a period of time with DC Health on getting our capacity for contact tracing up. And there are two metrics that they'll be looking at. The first one is looking at ensuring that we make our first contact with someone who's been newly tested positive for COVID-19 within 1 day of learning of that positive test result, and that needs to occur over 90% of the time. And the second is ensuring that we're making the first contact with all close contacts of people who test positive within 2 days of identifying who those people are. And that also needs to be over 90%. The district is just now standing up its full capacity for contact tracing, and so there isn't data to report on that yet, but that both of those have to be at over 90%. And once we achieve those, then we will be able to move to stage 3. Just so people are aware, we are working with a group that includes stakeholders, providers, DDS staff on helping us to define what all of our services really, helping to develop and publish some guidance that will show exactly what services will look like as we move through each of these stages. A particular interest, of course, is day services, but across the board, making sure that people are aware, what's it going to look like in terms of service coordination through each of the stages. I will give you some previews of that, which are that even when we get to stage 2, at that point in time, the recommendations regarding visitation for people are that they can then, once again, have visitors in their home, but we also want to continue to move cautiously. COVID-19 will still be with us at that point, and remote work during stage 2 is still strongly encouraged. And so even once we get to stage 2, we will continue to provide service coordination remotely. We will continue to do monitoring remotely. Any provider certification reviews that are done will still be remote. None of those face-to-face contacts will happen until we get to stage 3. And just so people are aware, the general definition for stage 2 is only localized transmissions. And that the metrics for demonstrating only localized transmission are those that I provided to you before. Stage 3 is defined as sporadic transmission, and we have not yet seen how DC Health and the mayor's office will define sporadic transmission. Stage 4 is already defined. Stage 4 is when we reach that new normal, and it is at that point is when we have either a cure for COVID-19 or an effective vaccine. And so until we are at stage 4, we are not at a point, really that's sort of the new normal in DC. And up until that point, just as a reminder, as I like to do in these calls all the time, it is essential that we continue to practice all of those safe habits that are necessary to keep the risk of transmission low for everyone, which includes, of course, social distancing, making sure you're standing at least 6 feet away from anyone else, using face coverings for those times that you may not be able to maintain that social distance, making sure that you are washing your hands for at least 20 seconds regularly throughout the day, and doing your best not to touch your face. I think that's everything I had to share. We actually, in advance, had only gotten one question, and so people can certainly feel free to ask questions via the chat box.
Mm-hmm. The question is, I was informed my provider received an increase because of COVID-19. Was I supposed to get a raise?
So I haven't seen a question in the chat box about this yet, but I'm going to assume and provide a response to a sort of follow-up question to this. As people may be aware, we published the Appendix K, which was, it allowed us to make some changes in our payments for waiver providers. As that was published, we identified some areas where we felt that we needed to make some amendments. We still do not have an answer on the status of those amendments. The Appendix K, which we have reviewed a couple of times in these meetings, established new rates for providers, including adjustment to daily rates in residential placements. In the Appendix K, it was described as to account for the possibility of increased overtime. We also established a modified rate, what we were calling a quarantine rate for people who were working in instances where there was a person who had tested positive or where there had been an exposure and a person was self-quarantining for 2 weeks because of the expectation that it could cost more to pay someone to work in that circumstance. And so we enhanced the rate in that instance. Each of those changes to the rates, however, are changes to the rates that we pay providers. So specific questions about what the provider pays their individual staff really need to be addressed within each provider agency. There are provider agencies that had already enhanced their rate on their own and were working out how they were going to pay for that and are, working with us on what the Appendix K includes so that they can cover those costs. In addition to the changes that we've made, DHCF also made changes in their payment to providers to address cost shifts that were there in the intermediate care facilities. All of those, though, are changes in payments that we make to providers. So people should really ask at the individual provider level when they have questions about how the payment is calculated for them. I also happen to see a related question about we have done the necessary posting for the July 1 rates. We're ready for the July 1 rates, which is when the new minimum wage goes into effect, and things will be adjusted accordingly at that time.
Is there a modified rate for in-home supports other than the overtime and quarantine rate? And all hourly services have been modified in the Appendix K submission that has yet to be approved.
In other words, we don't know. So one of the things that we recognized is that we had modified the rate for all the daily rates, and the original Appendix K included an overtime rate, but it did not include an enhanced rate for the hourly rate for 6 services. And we have pending an amendment to our Appendix K that will address that, and unfortunately, it is still pending. So at this time, the answer to that question is no.
This question, Dr. Brown indicated on the call last week that he is not able to get into hospitals now. Why is that? How many people who were hospitalized with COVID has he been involved with? And this question has been answered in 3 different ways, and I just don't feel that we should be sharing individual hospitalization data on our contractor on this call.
So I just want to say a couple of things. One is Dr. Brown consults, he doesn't treat. And so we can work with the DC Hospital Association regarding challenges with access to direct care for patients. But but Dr. Brown has been able to consult with treating physicians for people who are hospitalized. So I don't want to mislead people in that regard. It's not that he's not available once someone goes into the hospital. Dr. Brown, people who know him would know that I think he's much more comfortable being able to lay eyes on a person when he's consulting, which historically had not been the way our consulting physicians had done things. They had done much more they were very much prepared for our COVID-19 days of doing things remotely and being able to consult with doctors over the phone or view the medical records remotely. We had published, I believe, our guidance about when the consulting physician gets involved. As I said before, we currently have 6 people in the hospital. I don't know the specifics of how many of those he's consulting with.
I think the sound is cutting out.
Good afternoon, everyone. Are providers permitted to sign, auto or hand, for any people that they are working with pending verbal consent on file in writing from people?
I don't really understand that question, frankly. I mean, maybe you have a guess at it, Winslow, but I don't understand.
Can we open it up, someone can clarify?
Yeah, could that person, well, they text their question, because as some of you know, not everyone uses the WebEx, and that question came in via text. So that question needs to be clarified. Wasn't there a second part to that?
So are providers permitted to sign for any consumers that they are working with pending verbal consent on file from consumers?
No.
That whole question, frankly, has me confused about verbal consent. I mean, even consent generally, in that I don't even know what this person is supposedly consenting for. Because in most instances, if we're talking about telehealth and how consent works when you're doing telehealth, that's a question for the doctor who's providing the service.
Or the clinician.
Right, whatever clinician is providing that particular service.
So we have a question. Next week, can we have MTM present and let us know what steps they're taking to keep people safe and how they anticipate operating as we move forward? And that's an excellent idea, and we'll reach out to MTM today and see if they'll be available. Yeah. The ones I can answer.
Are there any other questions?
How many residents are currently considered under quarantine? Excellent question.
So with the homes that are being monitored because there's been an exposure, there's just 4 homes with 10 people.
And the next question is, and I do apologize, what is MTM? MTM stands for Medical Transportation, someone said that it's a medication transportation provider. They are actually the broker of the transportation providers, and they actually assign transportation companies to provide pickups and drop-offs to medical appointments and other habilitative type of services. But we'll reach out to them. As a matter of fact, I'll email them as soon as I get off the phone and see if they'll be available to come and talk to us. It's a big one.
Good afternoon, Dr. Reese. This is Kirk. I just wanted to clarify the last comment that came in before. The text message that was sent said, to clarify, referring to individual treatment plans, some vendors seem to think that they are permitted to sign plans for RSA consumers under current COVID-19. Is this not illegal or unethical?
Kurt, can you repeat what you said?
Kurt, can you repeat the question, please?
Sure, sorry, my phone was muted. It said to clarify, and this is going back to the confirmation for verbal consent or written consent. The person responded to clarify, referring to individual treatment plans, some vendors seem to think that they are permitted to sign plans for RSA consumers under the current pandemic. Is this not illegal or unethical?
I won't get to legal or ethical issues. It is inappropriate. There aren't treatment plans, first of all, that RSA is involved in. There are individualized plans for employment, and they specifically call for the client's signature. We have addressed this multiple times on this call, in which I have said there are circumstances where we are waiting for the client to return the document with their physical signature on it, and as long as they confirm that they have signed it, we'll have written on our record, client consented, mailed for signature, and that's good to go. And then we need to make sure, and what has happened quite often in the past is that we've worked with the provider who is working directly with the person and sees them physically quite regularly to make sure that the provider gets the document from the person and gets it back to us. But this is not something that is new, quite frankly, with COVID. We have, I won't estimate the number, but well over 100 people who attend college outside the DC area. So we deal with having to get signatures from people who we don't work with physically all the time. And this has not changed with COVID. And there is no one, unless they've been specifically authorized as a representative for the person, who is authorized to sign on behalf of a person.
As we engage with people we support around reopening, we're consistently asked about what type of visits are okay. We're continuing to restrict in-person visits in the home as noted, but is there any restriction on arranging outdoor visits with families/guardians following appropriate social distancing and masking guidelines? Would you ask that these be tracked in our visitor screening logs if facilitated by the provider?
So they're not a visitor to the placement, so there's no requirement to log it there. However, keeping in mind, okay, first of all, there is no longer a stay-at-home order, so visitation with people outside the home can occur. And I would hope is occurring. People have been in for a long time, and they're probably wanting to see people. And as I said before, it is essential that we continue to practice all of those practices we know of in terms of regular hand washing for at least 20 seconds, maintaining social distance, standing at least 6 feet from people, keeping on face covering. And those things should also be practiced if people have a visit with family members. Now, the one caveat, where you said, would it be a good idea to maintain that information? If they're visiting with family, we have their contact information already. If the person were to test positive through this contact tracing force, we would then have to identify, within this period of time, within the particular period of time that the contact tracer asks about, with whom did they have contact and how can we get in touch with those people? But I would expect that if someone's visiting family, we already have all of that information. But yeah, it is important. It's important to know too, my understanding, like restaurants that have opened are supposed to be collecting the names of everyone that comes to the restaurant. And the purpose of that is, in the event there is a positive result, they're going to have to reach out to those people to say, on the day that you were here, someone who had close personal contact with you tested positive, and therefore, you may need to get a test. So it is important to know who the person had contact with. For people who are out and about, you need to be sort of documenting it for yourself where you're going in the event you're going to have to provide that information to someone later. But that's the kind of thing that contact tracers are used to doing, in that, I made an appointment to get my hair cut, but I don't remember the person's name, but it was here's the address where I went. It's their job to track that kind of stuff down.
Our persons are currently not able to complete spend down plans because some of their vacation plans has been canceled. How do we handle over resources to prevent our persons from losing their Medicaid benefits during the pandemic?
As part of the planning process, you should be looking at the resources someone has and what needs to be spent and how it's, and then making plans together about how it should be spent. Is there equipment that the person doesn't have that they would benefit from having? None of us are able to go on vacation right now. And so for many of us, it means the ability to save, have people looked into ABLE accounts, because that's a way that many of the people we support can save and keep resources protected from counting against you in order to maintain benefits. I think that it's a great question because people need to be thinking about it. It's a great problem to have that I have this money that I haven't spent, so what's a responsible way that I can either save this money in a particular place where it doesn't count as a resource against me, or what is an appropriate resource that I need to purchase that I hadn't planned for originally that might benefit me going forward. And those are issues that really need to be addressed by the team.
For those on the phone, our general counsel has provided this statement: providers should never sign for the person. Substitute decision makers and guardians are only persons who should be signing for people, and only in those limited circumstances, usually for medical issues, unless it's a general guardian. And moving right along into the next question. When do we anticipate reopening day programs?
So that's a really good question, and we're working with day providers. There's a group that's meeting again next week to talk about that. One of the things that I think is really important for people to be aware of, we're actually working closely with, in doing the planning currently, we're working closely with providers and some stakeholders to look at this question, not just about facility-based day programs, but about all of our day services and how do we move forward with people re-engaging in services outside the home. But as it relates to facility-based, we're also coordinating closely now with the Department of Aging and Community Living, because they have some of the same issues that we do regarding concerns about the safety for people of attending a facility-based program like that. And together we'll be working with DC Health to make sure that any recommendations that we have ensure the safety of the people attending these programs. Just so that people have an idea of where those recommendations seem to be headed. I don't see, given our current circumstances, that we will have the opportunity for any facility-based programming where you have more than 10 people in a facility, or at least a part of a facility that is isolated from the rest of it, including people supported and staff, until we get to stage 4, which is there's a vaccine, an effective vaccine, or a cure. And until that time, we're going to have to maintain these social distancing practices and these good hygiene practices of regularly washing hands, staying 6 feet from people. This is really going to preclude any kind of large day program where you have more than 10 people. It may be that you have facilities where you can create sort of a couple different facilities within a facility, but you're not going to have a facility with, any kind of shared staff or shared facilities where there are more than 10 people for quite some time.
The next question. With the change in environment due to COVID-19, is there a plan with DDS to subsidize training, utilization of technology to improve services to our people, given that acquisition of these technologies may be out of reach for small providers? So it's a very interesting question, but we do have within all providers who support people residentially, their budgets for those residential supports that include cable and include telephone. So with regard to the technology, I just wonder if it's a matter of purchasing a computer, and I heard someone talk about spend downs a little while ago. The idea that we'd have to approach those on an individual basis, determine what the person's needs are, and then determine how to acquire the specific technology. And in terms of training, I know that there are opportunities where we're seeking to become a part of a grant where that is exactly what we'll be doing for folks in terms of supporting them in assessing their technological needs, supporting their ability to use the acquiring the technology, and then the use of the technology.
I just noticed that Precious added to the response to one question, which I think was really helpful, which is that keeping in mind that in some homes you could easily get to more than 10 people in the home, and people need to be very aware of this. Keeping in mind, first of all, in stage 1, which is where we are right now, there still should not be visits happening in the home. In stage 2, when there will be visits happening in the home, you still have to think about what those visits look like. And thanks for reminding us of this, Precious, which is you still shouldn't have more than 10 people. You know, you can't have that big family birthday party, even in stage 2, where you've got a whole bunch of people close to each other. We've still got to be practicing safe social distance, face coverings, and hand washing throughout stage 3. And so it's going to be really important for people to remember to keep these protocols in place in stages 2 and 3 about maintaining safety within the home.
We received a comment. Thank you for mentioning ABLE accounts and a website for more information. So that's https savewithable.com/dc/home.html.
Someone had also mentioned, I don't see it in the comments anymore, someone had also mentioned that a good thing for people to be considering doing with their vacation money might be thinking about technology needs they have and addressing them with those additional funds that are available to them.
There's a question on when is stage 2 starting. We're going to put the link that will give you the information that the director shared earlier in the call, not to go back and repeat that because we have already covered that earlier in the call.
But you can get up-to-date information at coronavirus.dc.gov, and you will see in the link at the top of the page, it provides you with the current status in terms of right up at the top, it says there's the situational update. And so you can see what was provided. As people may be aware, the mayor has press briefings Monday, Wednesday, and Friday at 11 a.m. And it's very helpful to tune into those because you will get real-time updates in those press briefings.
There's a question. Are there specific DDS guidelines for taking persons served on vacation?
So first of all, in stages 1 and 2, travel is discouraged unless it's traveling to refers to non-essential travel. So unless it's to accomplish some essential thing, travel is discouraged. So until we get to at least stage 3, talking about traveling for a vacation is not really appropriate. And, you know, the thing to keep in mind, the district has been doing quite well in seeing the numbers of new cases go down. There is not consistency across the country in enforcing the kinds of necessary restrictions to ensure that the numbers stay down. So as people begin to think about traveling, that's something you really need to think about, is what the guidance is in the state where you plan to travel to, which is one of the reasons for discouraging travel, is that, you know, we know what steps are being taken in the district to ensure people's safety.
June 19th is the schedule for stage 2. Is that correct?
No. As I mentioned at the beginning, there are certain metrics that need to be achieved, and the best thing to do is to log into the mayor's website and then to listen to the press briefings each day. And from that, you will be able to tell, because, you know, as I look at the guidance that I reviewed at the beginning, there wasn't yet data on the contact tracing force. And June 19th, isn't that just about a week from now? Yeah, that's next Friday. I am not aware of anyone saying that we are going to get to all of these metrics by next Friday, especially given that we've got to be over 90% in our contact tracing capacity in contacting people who've newly tested positive and contacting contacts of people who newly tested positive. For people who tested positive, that's within 1 day. For their contacts, within 2 days, over 90% of the time. Now, for every other metric, it is a reality that we could be there by next week, because the requirements are, you know, sustained decrease in community spread for 14 days, and we're already at 9 days. Low transmission rate, so we need to see that number stay below 1. It's been below 1 for some time now, but it needs to stay there for 5 days. Positivity rate below 15% for 7 days. It's currently at 7.5%. So, you know, we hope that stays low. Maintaining the healthcare capacity at below, that the healthcare utilization is below 80% for 14 days to ensure that we have what's called surge capacity, and making sure that contact tracing capacity is where we need it to be. So is all that going to be there? Unless the mayor announced this morning that her view is that we're there, I have not heard that. And, you know, like I say, the best thing is to just keep watching the mayor's press briefings, and you will get the real-time update there about where things stand in terms of these various metrics.
For providers that are based outside of the DMV, are we to follow our own state's protocol?
Absolutely.
So for those of you on the line, you can text 202-590-7618, 202-590-7618, or you can text your questions in the chat box. We'll hold for a moment for any additional questions.
Hi, good afternoon, Director Reese. This is Kirk again. There was a question that came in as a follow-up to our over-resource issue. Is the threshold now $4,000 as opposed to $2,000 for SSI concerns? Again, as a follow-up to our over-resource issue, is the threshold now $4,000 as opposed to $2,000 for SSI concerns?
Can I just say, Marie, I thought you were a mental health professional too, because I'm quite comfortable with the silence. I always allow the silence to do the work so that people then come up with additional questions. And I understand that someone texted in a question, which was a question about whether there's been a change in the resource limit for Social Security. I'm not aware of such a change. The one issue related to resource limits and Social Security is that people who received the $1,200, that they're allowed a year, that does not count toward their resources for a year. They're allowed a year before they have to expend those resources. In the same way, people who get a back payment are allowed additional funds. I think Sandy's responding to this saying the resource limit on Medicaid is 4,000. We'll have to check into that and we'll confirm it next week.
July 1 living wage will there be a standard increase in all rates to accommodate all aspects of waiver services or just those services that involve DSP?
I'll confirm next week. My recollection from the rate adjustment is that it was just those rates that were affected by the wage increase. But I will confirm that. We have those rates ready to go, but we have prepared those with the assumption that we will hear back we have prepared those with the assumption that we will hear something back from CMS regarding the Appendix K amendments, and so we're hoping we can publish all of that at once. If we're not able to, then we'll have to cut out just the July 1 rates without the Appendix K adjustments.
Yeah.
How are these resources being measured when individuals are still not receiving payments because of certain demographically issues, for example, closures and shutdown?
I'm not aware, and Danielle, perhaps you could type in a follow-up here. I'm not aware of an issue with people receiving their funds. So can I just ask, I'll ask another clarifying question. Sandy, are you saying that these asset limits are any change, or they're just the existing asset limits? Thank you. So, okay. Perfect.
Can we open Danielle's line? Are we able to do that?
Hi,
I know
Danielle, your
there's
line
this
is now open if you would like to speak.
I know there's this issue about people receiving stimulus. There are lots of people that have not yet gotten their stimulus checks, and you have a year from when you get it to spend those resources. So, so someone asked, is it fine for our person supported to go out in the community, even retail stores and the like, as long as the guidelines are followed? Yes, except that most retail stores are not yet open. They have curbside service, but absolutely it is okay. People can go out in the community as long as you're following all those guidelines. That's the stay-at-home order has ended. Even throughout the stay-at-home order, we had encouraged that people should go outside, get sunshine, get exercise, and now there are some more things that people can do. Frankly, it's quite limited, but there are some things that people can do. You do not want to take a group of people to the grocery store still. You know, when people are going grocery shopping, it should be one person from the household that does the grocery shopping, because we still want to do everything we can to limit the number of people who are indoors at any kind of a building.
Okay, we received another question. The SRC is actively working to make waivers for RSA federal. What is the status of waivers for RSA?
So my understanding is that the Secretary of Education requested from Congress, although Congress had included the ability to do these waivers in one of the, I don't know if it was the CARES Act or the subsequent act, and the waivers that were being requested related to the requirements to expend 15% of the VR grant on pre-employment transition services during FY20 because many states were being challenged by this because schools were closed, and so providing those services was more challenging, and not being able to expend that 15% could reduce other parts of the VR grant. So they were asking for a waiver for that. There's a requirement that 50% of the supported employment grant be expended on youth with disabilities, which is youth up through the age of 24. And so they were asking for a waiver for that requirement on the supported employment grant. And lastly, at this time, they were also asking for a waiver to extend the amount of time allowed to spend FY19 carryover funds, which all have to be spent by September 30th, 2020. And so they were asking for an extension on that. Just so people are aware, some VR programs in the country shut down and were not providing services at all during the pandemic. And so they were really struggling with some of these requirements. In the district, we actually spent about 2 weeks since the pandemic began. We've been able to process applications. We have been able to coordinate with people. As people familiar with VR know, we're supposed to rely to the extent possible on existing evaluations. So, you know, the challenge with getting new assessments hasn't been much of a challenge because ideally people will come with evaluations. We've been working remotely on processing applications with people and been moving things along quite effectively. We've also been working with a number of our providers and with the Department of Employment Services to provide pre-employment transition services to youth. So we're hoping, even though we are hopeful that there will be a waiver of these requirements, we are hoping that at least for our pre-employment transition service requirement, that we're able to meet that requirement this year, and that in the district we will be able to provide all those necessary services to youth to help prepare them for employment.
And our general counsel commented that the public notice for the increase of living wage identities of the IDD waiver services are published in today's June 12th DC Register. Is there a particular number to dial to ask a question for those who are on the call by phone? And you can text that's 202-590-7618, 202-590-7618.
And I do see that it's after 1 o'clock, and just as a reminder to people, you could also submit questions in advance, and then we'll answer them at the beginning of our meeting next week. So if there are no other questions,
and the deputy of RSA commented for RSA questions, if you need further clarification, contact him at 202-442-8606, 202-442-8606, and that's Darrell Evans.
so thank you to everyone. Please enjoy this wonderful spring weather that we're having today that's supposed to last into tomorrow. Once again, I do just want to express thanks to the extent we have direct support staff, provider staff on the call, thank you for all the work that you're doing for the people that we support. We do recognize that you've been on the front line here, and that we are seeing tremendous progress now in people really learning all the steps that we need to take. We've been learning as we go about, the importance of face covering in all circumstances. That we've really learned to do this better. And because of that, the numbers that we reported today were the same numbers we reported last week, with the exception that we have more people who've recovered. And that is tremendous progress and was really good to be able to report. And so thanks to all of you, and I will talk to folks next week.